3. Radioisotope traces. Some chemicals, including their radioisotopes, are absorbed by specific organs. When selected radionuclides are introduced into the patient's body, the doctor may start to trace their movement inside the patient's body. The radionuclides serve as traces. A. Laterally absorbed. Isotopes have the same chemical and biological properties. So all isotopes of iodine, including the radioisotopes, are absorbed by the thyroid gland, and so it is used for imaging of the thyroid gland. By comparing with the images of a normal thyroid gland with an abnormal one, both formed by radionuclides, a less blackened image indicates that the absorption of iodine is somehow suppressed. The lower intake of iodine is a symptom of non-functioning thyroid gland, which could be a cyst or a nodule of cancer. B. Combined with other substances. Radionuclides may be introduced by combining with substances that are normally absorbed by the target organ. Liver absorbs colloid, which is large particles in the blood, to metabolize them, which means to break them down into smaller particles. So doctors combine radionuclides with colloid and use them to be tracer to produce radionuclide imaging. 4. Gamma camera and image production. Gamma camera detects gamma radiation emitted from inside of a patient's body, usually from traces. As radiations from inside the patient's body may travel in all directions, the detector has an array of collimators so that only the radiations travel perpendicular to the detector crystal is detected. As the detector is placed right above the target organ, the attenuation inside the body is usually negligible when radionuclide imaging is used. With the use of a computer, a map of detected radiation, which is also a map of distribution of radioisotopes in the patient's body, is generated.
Before the CT examination, the nurse will verify the patient's identity, confirm his or her health situation, explain the risks and the process of the examination. The patient must sign a letter of consent before taking the examination. For a contrast-enhanced CT examination, the nurse will insert a needle in a vein on the patient for later injection of contrast medium. This is a CT scanner. Inside the machine there is an X-ray source on one side and a row of detectors on the other side. Before the scan, the nurse will position the patient on the examination bed. the patient will be injected with a contrast medium which highlights the internal organs in the body. A contrast medium injector is now connected to a needle in the patient's vein. This patient is going to have a CT scan of the chest. His chest will pass through the scanner for this examination. The radiographer in another room monitors the patient through a window and controls the scanner with a computer. An initial low-dose scan is performed to show a rough image of the patient's body. The radiographer will use this to plan the subsequent scans for the part of the body of interest. Once the coordinates of the scans are confirmed, the scanner starts and the patient passes through the scanner. Contrast medium, if required, is injected now to coincide with the scanning. Several passes may be made if we want to see different stages of contrast enhancement. While the patient is slowly moving through the scanner, the X-ray source and detectors rotate around the patient's body. As a result, the X-ray source and detectors relatively move in a spiral path over the patient's body. After the process has been finished, the computer will construct images from the data, which is effectively an attenuation map. It can also generate three-dimensional images. The images obtained need to be processed by the radiographer. The processed images are then output as films, color prints, or CD-ROMs. The images are passed to the doctor for further analysis and interpretation. A report of the findings and diagnosis is then issued.